A man walks into a hospital for a routine MRI scan. Nothing unusual. He lies down on the table, the machine starts up, and within seconds he is screaming in agony. The worst headache of his entire life hits him like a bolt of lightning. Doctors rush in. They pull him out of the machine. Something is terribly wrong. What they found on emergency CT scan would leave every doctor in the room speechless. A 7 centimeter nail lodged inside his brain, and it had been there for 5 years. This is the real CT scan. That white line you see, that's nailed inside a living person's skull. And he had absolutely no idea it was there. This is the curious medic, and this is one of the most unbelievable cases I have ever came across. Our patient is a middle-aged man, a professional carpenter. He spent decades working with woods, power tools, and nail guns. He is the kind of guy who had his share of minor workplace injuries, cuts, bruises, nothing serious. 5 years before this MRI incident, something happened. While using a nail gun on a project, the tool misfired. He felt a sharp, stinging like pain in his nose, and he also observed some bleeding from his nostrils. But there is a thing. The bleeding stopped within a minute. He felt fine, no dizziness, no blood vision, no headache. He assumed it was just a minor scratch, or that a fragment has gauged his skin. So he did what most of us would do. He ignored it. He went back to work, and for the next 5 years, he lived a completely normal life, with a nail stinging inside his brain. Fast forward 5 years, our carpenter goes to the hospital for an unrelated medical issue. His doctor orders him an MRI scan, a completely routine procedure that millions of people undergo every year. Now, for those who don't know, a MRI works by inducing the magnetic currents. The MRI stands for magnetic resonance imaging. Uses incredibly powerful magnets. We are talking about the magnets that are 30,000 to 60,000 times stronger than the Earth's magnetic field. That's why they always ask you to remove all metal. There are real cases of MRI magnets pulling oxygen tank across the room like missiles. The force is unimaginable, and now imagine that force pulling on metal that's buried inside you. The moment the MRI poured on, the carpenter felt it. An instant crushing headache, unlike anything he had ever experienced. The magnetic field was pulling the nail inside his skull. The nail was trying to move. Doctors immediately stopped the scan, pulling him out. They knew something was very wrong. They ordered emergency CT scan of his head. And this is what they found. A nail, a complete intact nail, sitting inside his cranial cavity. It has entered through his nose, passed through the nasopharyngeal sinus, and lodged itself in his brain. For 5 years, this man has been walking, talking, working, and living with a piece of metal inside his skull. How this is possible? Now, I know what you are thinking. How can a nail be inside your brain for 5 years and you don't know? Let me explain. The nail entered through the nose. Now between our nose and our brain, there is a very thin bone called cribriform plate of the ethmoid bone. It's paper thin. A high velocity nail from a nail gun can easily penetrate this bone without causing a visible external wound. The cribriform plate is so thin that in some cases it's less than a millimeter thick. That's thinner than a credit card. This is the only barrier between our nasal cavity and our brain. The nail came to rest in a frontal lobe. Now here is the fascinating part. The brain has no pain receptors. The brain cannot feel pain. So the nail was sitting there, not causing any pain signals at all. Yes, you are right. The organ that processes all your brain cannot feel pain itself. That's why brain surgery can sometimes be performed on awake patients. Additionally, the frontal lobe has what we call the silent areas, regions where small lesions or foreign bodies can exist without producing obvious neurological symptoms. If a nail has lodged a few centimeters to the left or right, near the motor cortex or Broca area, or any major blood vessels, this story would have been entirely different. So now, the doctor faced an impossible decision. They knew there is a nail in this man's brain. And question is, do they try to remove it? On one hand, a metal foreign body inside the brain is ticking time bomb. It could cause infections, brain abscess, seizures, delayed hemorrhage at any point. But on the other hand, after 5 years, the brain has formed a scar tissue around the nail. Blood vessels may have grown around it or attached to it. Removing it now could cause catastrophic bleeding, stroke, or permanent brain damage. After extensive evaluation, the neurological team made a difficult call. Surgical removal was deemed too dangerous. The risk of surgery itself was greater than the risk of leaving the nail in place. Our Carpenter was placed under a long-term observation, regular CT scans, monitoring for any signs of infections, seizures, neurological changes. He walked out of the hospital that day still carrying the nail in his brain. This case teaches us several mind-blowing things about the human body and medicine. Lesson number 1. Your brain has no pain receptors. A nail can sit inside it for 5 years without you knowing. The headache you get, those come from the membrane around the brain, blood vessels and muscles, never from the brain tissue itself. And the second lesson, MRI machines are incredibly powerful. This is why the screening process before the MRI is two metal implants, pacemakers, or in this case a forgotten nail. Anything ferromagnetic inside your body becomes a potential weapon inside that machine. And never dismiss a workplace injury, no matter how minor it seems. Bleeding from the nose after a nail gun mishap, that deserves an X-ray at the very least. 5 minutes at the ER could have detected this nail 5 years earlier, when removal might have been safer. A human brain is extraordinarily resilient. This man lived 5 years with a foreign body inside his frontal lobe, working, talking, functioning completely normally. The brain's ability to comprehend and adapt is nothing short of a miraculous. Somewhere in world right now, a carpenter is going about his day, a nail inside his brain. Doctors decided it's safer to leave it than to remove it, and he's alive, healthy and functional. If this case blow your mind, hit subscribe and bell icon so you don't miss the next one. Drop a comment. What do you think about this case? If you were this patient, would you want this nail to be removed or leave it in? I want to hear your answer. Until next time, stay curious.